Yeah, so my name is Mary Sang. I'm a pharmacist. I work in Baringo County. And my presentation is really about how we can bridge financing gaps, how we are trying to do that in Baringo. So in terms of expenditure on health, it has high returns in terms of health outcomes and economic development. Because of course, if people are healthy, they are more productive. So it means it's important for the sector to increase its financial capabilities in order to bridge financing gaps. So Baringo County and maybe other entities have been grappling with health financing gaps. So we identified the NHIF reimbursements from Linda Mama as one of the ways of bridging financing gaps. So this is a platform whereby the expectant mothers are able to get services, and then now the facility is able to get reimbursements for those services from NHIF through the Mama program. So the objective was to increase reimbursements from this Linda Mama program in our health facilities in order to improve financial capacity. So consequently, this will contribute to improving the quality of health services once you have increased financing. So what we did, we identified 3 facilities to pilot this intervention. This was in 2019. So at that time we had 6 sub-counties, there are now 7. So we clustered them into 3. So we grouped 2 sub-counties together. So in the Marigat and Baringo Central, we picked Loboi Dispensary as a facility to pilot. In Baringo North and Tiati cluster, we picked Baruesa Health Center. And in Koibatek and Mogotio, we picked Emining Health Center. So what we did was to sensitize now the health workers in these 3 facilities to buy in and to really understand the concept. And then after that, we did a benchmarking visit to a facility in Nakuru that was doing really well. That is Keringet. And we were able, through an NGO that was supporting us at that time called Afya Uzazi, we were able to visit that facility together with representatives from these 3 facilities. They were able to see the procedures that you need to do in order to authenticate the claims, and so that they are not rejected by NHIF. And they saw a positive utilization of the funds because that facility had done so much with what they had received. So I was comparing 2019 and 2021 because 2020 was somehow like a COVID year. So I just picked that initial year in 2019 and now the year that ended 2021, December, the calendar year. So if you look at Loboi, in 2019, they were able to get reimbursements to the tune of 51,000. And in 2021, it had moved up to 110,000. Emining in 2019 had 249,000 up, and then in 2021 up to over 506,000. Baruesa from 590 to 1.08 reimbursements, which is a lot of money, which they really used well. So I just picked some of the things that they have done with the funding they've received. So Baruesa Health Center, for example, they were able to renovate their staff house and outpatient block. They were able to also replace the water tank, and they were able to pay a technical officer, a nurse, as well as a data clerk to be doing the follow-ups. They also procured mama packs that are given to mothers who've delivered, and they were able to give warm drinks to the mothers after delivery. For Emining, they were able to refurbish their maternity units. They were able to pay a stipend to their casuals. They were able to pay their bills, and then also procure supplies like gloves, which were in low supply at that time. For Loboi, they were able to procure a photocopying machine, a laptop, and even a water dispenser. They paid their bills, their casuals, and they partitioned the room. So this is the water tank that Baresa procured, as well as the renovation of the outpatient lab and store block, what they did in Baresa. So basically, it means that learning visits or exchange visits to health facilities that are doing well can have a positive effect on other facilities, because they can see what others have done and try to emulate the same. Also, reimbursements from Linda Mama have the potential to improve health service delivery, and the financing gaps can be bridged by resources within our reach. So I'd like to acknowledge the county team, as well as the sub-county team leads. I'd also like to recognize Edith from Emining, Koskei from Loboy, and Rubut from Baruesa, and Afia Uzazi, that whose program ended, but who helped us to jumpstart this. Thank you.
Asante, Dr. Mary Sang, thank you very much for that. It's probably what we call Kaizen, concerted, little concerted efforts, but are probably are giving in this change. And let's probably go to the questions that you yourself, you're able to, we'll combine a private sector and a public sector question together. We will be able to probably see after this, the questions that will be coming in from the public sector. There's Dr. Chris Masila who's asking a question. Thank you, Maidawa, and Dr. Sharana for sharing the Maidawa story. Question is Maidawa countrywide or just in Nairobi? And do you work with the public sector? Secondly, is there a telemedicine consultation component of Maidawa? And finally, are there any plans to set up out of Kenya? Dr. Elizabeth?
Thank you for the question. So at the moment, physically, we are in Maidawa. We are based in Nairobi, sorry, but we do deliver countrywide. So in Nairobi, we have a promise of 4 hours delivery and 6 hours for the outskirts. But outside of Nairobi, we have a next day delivery promise. We do have plans to have physical branches outside of Nairobi and possibly outside the country, but that is not there quite yet. In terms of working with the public health sector, yes, we do. At the moment, for example, we have a project that we're doing with Bill and Melinda Gates Foundation in terms of delivering PrEP. So it's going to roll out officially at the beginning of next month, but the announcement was already made, so that we will be able to also join the public sector in distributing these health products, and they'll be coming for free because they'll be for the public health sector. So we'll not be charging for them, we'll not be selling. The other question was, is there a telemedicine or consultation component of Maidawa? Not at the moment, but we do have telehealth partners that we partner with. They are listed on our site, and whenever we get a patient who has called in or has contacted us and needs a consultation, we are able to link them up with one of our telehealth partners. Thank you.
Wonderful, Daktari. Wonderful, Daktari. Probably now that is a component of, are you working on, probably now we are moving from the COVID phase, and we are able now to, people have accepted the technology. During yesterday's one of the breakout sessions, the main question was on acceptance of technology. Are we as a country, because now as a country have moved to accept some of these technologies, probably the component you can look at is even to include clinical pharmacists on the panel to be for telemedicine. So a question from you is also, can Maidawa also supply to pharmacies? What are the requirements?
No, Maidawa is a retailer, e-commerce. So no, we do not supply to retail pharmacists. That would be a wholesale function.
Asante. Now we go to Dr. Mary Sang. A quick question from your esteemed colleague at Meru. Dr. Muduri Kome says, thank you very much. Thank you so very much, Dr. Sang, for that presentation. What are the strategies for scale up? This will help us a lot to address the challenge presented by Dr. Barasa to some extent.
Yes, we are encouraging sub-county team leads when they go for support supervision to encourage other facilities, because we are not able to reach everyone with the challenges of movement. But as much as possible, we encourage by showing them what others have achieved. So it's building up, but not as fast as we would have wished. But any county can do that, and I can assure you they'll benefit.
Okay, a quick one just before you're done. Dr. Mudhuri comes again and asks, does a facility need to have a maternity to benefit from Linda Mama, probably for the MCH and all?
No, actually you don't, because for ANC, post-ANC visit, there's some money you can claim. For postnatal care, there's money you can claim. So even if you don't have a maternity, you can still claim the money. So all you need is to register the mother and then photocopy the relevant documentation for NHIF to be able to honor the claim. Thank you.
Wonderful, wonderful, Dr. Now that shows that you're able to even increase funding to the public sector, and thus have enough monies for the supply chains for the public sector in terms of commodity availability. Okay, a question over now to Dr. Lisbeth. Where does Maidawa source your meds from? Probably you can answer it in the best way possible.
So we source our meds from the authorized local distributor of those brands, and where it's local manufacturers, we source directly from them. So as long as they're the authorized distributor or the manufacturer, we'll be able to confirm this and check their registration, that they're registered with the PPB, they're licensed to do this, and that is who we will source from.
Asante, Dr. Lisbeth. Probably now, as you are winding up, Dr. Mary Sang, there's a last question for you. How long does NHIF take to pay you? Give us a response to that as you give us your parting shots.
Yeah, actually, it takes a while, because as you know, NHIF is a parastatal. It also waits for money from National Treasury. The same way sometimes counties have delays. So the only thing is to be patient in terms of continuing with the claims. But however long they take, they do eventually pay. So the only thing is to encourage facilities not to give up and continue doing the claims. Once they get money, they actually pay everything. So yeah, that's a challenge, because sometimes people feel like giving up, but I would encourage them to continue. For my parting shot, there's so much we can we can use to build our financial capacities, because as we can see, resource envelopes are dwindling and we need resources for health. You can look around at this, whatever ways you can think can help. So let's just be vigilant and proactive. Thank you.